Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. Today we'll be talking about the Government of Guyana's Cervical Cancer Voucher program, and joining me in the program is Dr. Lachmie Lall, the Director of the Chronic Disease Unit of the Ministry of Health. Welcome to the program, Dr. Lall. So today we're talking about the cervical cancer screening voucher. Could you tell us a little bit more about this? Give us an overview on this voucher program.
So in 2024, Guyana launched a plan for the elimination of cervical cancer among our women in Guyana, in keeping with the WHO's mandate for the elimination of cervical cancer by 2030. And we did an analysis of our population, and roughly about 211,000 women between the ages of 21 to 65 are eligible for an HPV test. So what an HPV test is, we're testing for the human papillomavirus, which is a known cause of women. Once you're infected with the HPV virus, the chances of developing cervical cancer is greater in those women, particularly for women who might be infected with the strains 16 and 18. So we started this program in 2024 to test, not just a test for the presence of the virus, but the strain of the virus among our population, to see who is more at risk of developing cervical cancer. So apart from having the test is the first step in screening for cervical cancer. And we want every woman between the age of 21 to 65 to get this test. Once that is done, based on the results that we see, if it's positive, we then go on to do a vaginal examination to see that if there are changes at the level of the mouth of the cervix. If there are no changes, then we encourage the women to get tested again in about 2 to 5 years. For those women who are positive and we do see changes on the cervix, right there we can discuss what her options are, which usually would be cryotherapy, where we freeze the cells at the level of the cervix and we excise those, we take them out. If we do see signs that the cancer has moved a little higher up the mouth of the womb, that woman will have to be referred for a procedure called LEAP, which is a little more of an advanced kind of procedure that has to be done in a theater, and she will be referred for that service.
Dr. Lall, I know this program would have been launched in 2024. Tell us, what has the response been like from women?
So, given that we started the program at half year of 2024, we did manage to screen about 12,400 women, which I think was a pretty good number, given that it was just half a year. And we've seen the demand for the testing. We've seen that, like, for example, at the second to last day of the year, we saw that a lot of women were flocking the facilities to get the test done. And given that, we decided that the program will continue into 2025 because we want to reach all of those eligible women. We want to ensure that they're tested. The testing on this mass scale gives us a better picture of what's happening in regards to cervical cancer and the HPV incidence in our population. So I'm happy to say that the program will continue this year. We have had more providers come on board. Last year, we had just about 5 labs that were offering HPV testing. This year, we have a total of 8 labs. So we're hoping that with more providers and the availability of more vouchers, we're going to be able to spread out the program and maybe reach a bigger target this year.
For women who are a little more skeptical about going and get this test done, what can they expect when they visit the health facility to undergo this test?
Okay, so this test is very simple. The entire procedure will probably take maybe about 5 to 10 minutes. Of course, if it's that time of the month you're having your menstruation, we wouldn't recommend that you do the testing then. You can wait safely outside of the period once it is finished. And you can go to any of your healthcare workers. What they will do is do a simple vaginal examination with the use of a speculum. And it's a cotton swab that's inserted into the vagina, and they take a simple sample from around the mouth of the cervix. It does not involve any kind of pinching, no insertions of needles, nothing like that. Very simple procedure, very, very pain-free procedure as well. So I don't think women have anything to fear.
Thank you for sharing that with us, Dr. Lall. We're going to go into a short break and be right back with more.
The thought of developing cervical cancer may seem scary, but the good news is that it is preventable and treatable. The key is vaccination and being screened early. Cervical cancer is the second most common cancer in women in Guyana. It is caused by the human papillomavirus, commonly known as HPV. Almost all sexually active people will be infected with HPV at some point in their lives. Therefore, it is important that women aged 21 years or older get screened for cervical cancer. Prioritizing regular pap smears, VIA screenings, or getting an HPV test done is crucial. These tests will aid in detecting precancerous lesions, making it easy to catch cancer in its early stages. These screenings are quick, easy, and free of cost. They are available at various public health facilities in your region. Remember to spread the word and encourage your female friends, mothers, sisters, and daughters to prioritize their health. Early detection is key to successful treatment and a long, healthy life. Together, we can prevent cervical cancer. A message from the Ministry of Health.
My name is Romain Glasgow. I'm here to talk about cervical cancer. I've had experience seeing not just someone, a loved one, my mom, passed away with cervical cancer. After she was diagnosed with it on December 2023, it was tough because we started to wonder because we didn't prepare for it. And to know that you've lost your father and then you're going to lose your mom. She was living in Skeldon. And so when we go, the first time we take her to Georgetown Hospital, they admit her. They keep her there for a while. And they did some tests on her. They did a CT scan and so on. And so when the CT scan result come back and we saw it, we was like, what are we gonna do? And so we say, you know what? No, we're not gonna give up. We're gonna push harder. We're gonna try. We pushed until we reached to a stage where we had to do the radiation therapy. And take her there. The doctor said she didn't reach the requirement because her blood count was low. And every time they give her blood, she will go to there for the blood. And when she reached home back in the night, she will start bleeding it out. It reached to a point where she's not eating at all. And all she wants is just a little bit of water. And then, her body started dehydrated. She have no control over her urine. We decide that, this is it. As your mom, you have to be there despite what. And so we stood there by her until she take her last breath. My encouragement to us women, including myself, because I haven't taken the HPV vaccine as yet. And so seeing what my mom went through with cervical cancer, I don't want to go through it. And I don't wish it for any other women. And so I'm going to take my HPV vaccine. I encourage all women to do an early screening. Get your pap done. Get your VIA. Let's get our HPV vaccine to help prevent cervical cancer.
Mother, wife, sister, daughter, friend. Women play indispensable roles, shaping the very fabric of our society. But amidst their strength, a silent threat lurks in the shadows: cervical cancer. It's an abnormal growth of cells that starts in the cervix, mainly caused by the human papillomavirus. Each year, this disease claims the lives of hundreds of thousands of women worldwide. But it doesn't have to be this way. Cervical cancer is highly preventable with regular screenings and the HPV vaccine. And when caught early, it's treatable. Women, you are the heart of the world. So let's start talking about cervical health with healthcare providers. Encourage one another to get regular screenings and HPV vaccinations and adopt healthy lifestyle choices.
Your presence, your voice, and your contributions are invaluable.
Schedule your screening today. Together, we can end cervical cancer.
A message from the Ministry of Health.
To get started, open your phone's camera app. Most smartphones support QR code scanning automatically. If your phone doesn't detect the code, simply download a free QR code scanner from the Google Play Store or App Store. Hold your phone steady and make sure the QR code is clearly visible in the camera frame. Your phone should recognize it instantly. Once scanned, a pop-up notification will appear with a link. Simply tap the link to open it in your browser. You will now see a list of service providers that accept the voucher. Browse through the locations to find one that's convenient for you. To keep the information handy, take a screenshot or bookmark the page. You can also share the link with friends or family who may need it.
Welcome to our website. We're here to provide you with reliable health information, services, and updates. At the Ministry of Health, our mission is to protect the health of every citizen in Guyana. We are committed to offering accessible, high-quality health care, helping individuals and communities to lead healthier lives. On this platform, you can find a variety of resources to support your health journey. Check out our programs that cover different health needs, from preventative care to managing chronic diseases. Stay updated on our latest initiatives and policies aimed at improving public health across the nation. We'll keep you informed about the important public health updates, including alerts, vaccination campaigns, and community health events that promote awareness and education. Thank you for visiting, and we look forward to your continued connection with us in our shared goal of a healthier future for everyone in Guyana.
Welcome back to the Health Matters program. For those of you who have just tuned into this program, today we're talking about the Ministry of Health Cervical Cancer Voucher program. And with me is Dr. Lall from the Chronic Disease Unit of the Ministry of Health. Dr. Lall, could you tell us who can get the voucher?
For the HPV voucher, any woman between the age of 21 to 65 is eligible for this voucher.
Where can they uplift this voucher?
So vouchers are available at all health centers and hospitals, any health facility across the country.
Any health facility?
Yes. Additionally, what we have done, we have also distributed vouchers to line ministries, to organizations. We have enlisted the help of the NGOs as well. They are also doing outreaches to different communities, and vouchers, they are taking vouchers with them as well. So cervical cancer is basically the presence of cancer cells at the level of the cervix, at the mouth of the cervix. Like we touched on before, one of the main causes of cervical cancer is exposure to the HPV virus, prolonged exposure to the HPV virus. Some of the other causes could be smoking. If patients have had frequent exposure to STIs, particularly those STIs that cannot be cured.
I know many times persons would usually wait until a health issue arrives and then they visit their health centers or, decide to go get screened. But could you talk about the importance of early screening and detection with regards to this cancer?
Right. So, and that's that's a very important point that you raised, because cervical cancer, it does not show a lot of symptoms. It's only until it has gone to an advanced stage that you will start to see symptoms. And that is why the Ministry of Health and the WHO as well pushes the agenda for early screening because you can have cancerous cells there and not show any kind of symptoms. It's only until the cancer has advanced and moved up, then you will start to see symptoms of bleeding. You'll see irregular bleeding that's outside of the menstrual cycle, painful sexual experiences. You might start to feel weak, among some other very non-specific symptoms that you might feel. And it's only until you actually examine the cervix that you'll be able to see what is happening there. So that is why we're pushing the agenda for early screening, because you cannot tell.
My name is Ms. Pauline Gofayo. I'm here to speak concerning cervical cancer because I'm a survivor. Well, my life, I had a wonderful life before. I was very active, very independent person. I used to like traveling a lot. I used to like doing craft, a whole lot. That was part of my job, and I used to enjoy it. In the year 2018, I noticed I started to lose weight, and I used to ask myself why. But I was a kind of person who was beyond the stress at times. As time go by, I find one day I started to have spottings. After then, I had a heavy bleeding. That is when I started to get curious and wanted to know what is really happening to me. So I went and I checked with the doctor. And when I went there, they said they suspect that because after my age, going into menopause or premenopause, I shouldn't be having those conditions. Then I got it, the news broke. Some of my challenges I faced after the diagnosis and treatment caused me some big changes in my life. The way I look, the way I think about myself, the scars from the radiation, fatigue, sleep habits also change, anxiety, stepping. I also started worrying a lot. Cancer is a terrible thing, but it did teach me some valuable lessons. I had to change my eating habits, to take better care of my body, to keep cancer away with nutrition. I had my children. Sometimes they couldn't support me financially, but the presence and the encouragement of them was there for me. And well, the Ministry of Health, they normally play a part too. They step in, and I also had outside help, like from the periwinkle, giving hope. Yeah, those were my supports. So my encouragement to you ladies is get tested early. Early detection saves lives.
In the world, every 2 minutes, a woman dies of cervical cancer, a disease preventable through vaccination and screening and treatable. Every death is a tragedy that we must prevent. In the Americas, cervical cancer is a common disease that kills nearly 38,000 women each year. The lack of equity in access to prevention and care is reflected in the difference in mortality rates. In Latin America and the Caribbean, there are 4 times more deaths due to cervical cancer than in the United States and Canada. That is why the Pan-American Health Organization is implementing the World Health Organization's strategy to accelerate the elimination of cervical cancer with specific goals for the year 2030 that is based on 3 main pillars: vaccination, screening, and treatment. By 2030, 90% of girls must be vaccinated with the human papillomavirus or HPV vaccine by the age of 15. 70% of women should be screened using a high-performance test such as the HPV test by age 35 and again by age 45. 90% of women with precancerous lesions and invasive cancer should receive appropriate treatment. The Pan-American Health Organization, PAHO, provides technical cooperation to the governments of the region to achieve these goals. Through the Revolving Fund and Strategic Fund, PAHO makes HPV vaccines and HPV testing available at a lower cost.
It is time to join efforts to adopt and promote an ambitious, coordinated, and inclusive strategy to accelerate the elimination of cervical cancer as a public health problem in the Americas.
Cervical cancer is on the rise in Guyana. It's the second highest cancer affecting women in our country. I wouldn't wish cancer on anyone. As a cancer survivor myself, I know how hard it is to battle cancer. And only recently, one of my family members, very close to me, came down with cervical cancer. Oh, how I wish that she had got tested before so that we would get an early diagnosis. So I'm asking you, please get tested. Please do your VIA, do your pap smear, and also get your children vaccinated. HPV vaccination works. It will save them from getting cancer in their later years. So please join this fight. Ensure you do the right thing so that you wouldn't have to worry like I had to.
Hi everyone, my name is Dr. Shivani Samuel and I am an obstetrician gynecologist at the Georgetown Public Hospital. Too many of our women are dying from cervical cancer. This is sad since it's a disease that is 100% preventable through vaccination and screening. One of the methods of screening that is currently available is a pap smear. This is a test in which cells of the cervix and vagina is collected, placed on a slide, and sent to the lab for testing. A result can either be negative or abnormal. A negative test will result in a follow-up in 3 years. However, an abnormal test, the follow-up will vary. Again, no woman should die from cervical cancer. Women, come out and get screened today.
To get started, open your phone's camera app. Most smartphones support QR code scanning automatically. If your phone doesn't detect the code, simply download a free QR code scanner from the Google Play Store or App Store. Hold your phone steady and make sure the QR code is clearly visible in the camera frame. Your phone should recognize it instantly. Once scanned, a pop-up notification will appear with a link. Simply tap the link to open it in your browser. You will now see a list of service providers that accept the voucher. Browse through the locations to find one that's convenient for you. To keep the information handy, take a screenshot or bookmark the page. You can also share the link with friends or family who may need it.
Welcome to our website. We're here to provide you with reliable health information, services, and updates. At the Ministry of Health, our mission is to protect the health of every citizen in Guyana. We are committed to offering accessible, high-quality healthcare, helping individuals and communities to lead healthier lives. On this platform, you can find a variety of resources to support your health journey. Check out our programs that cover different health needs, from preventative care to managing chronic diseases. Stay updated on our latest initiatives and policies aimed at improving public health across the nation. We'll keep you informed about the important public health updates, including alerts, vaccination campaigns, and community health events that promote awareness and education. Thank you for visiting, and we look forward to your continued connection with us in our shared goal of a healthier future for everyone in Guyana.
Dr. Lall, for women who still have their vouchers that they would have received in 2024, are those still valid for this year, 2025?
So that's a very good point that you raised. We just want to let the public know that even though you might see a voucher with a date from last year, once you have that voucher and you did not use up that voucher, it is still valid for this year. You can still go to any of the facilities listed on the back and you can get your HPV test done.
Yes, and I know that this voucher is valued at $8,000. So instead of women having to go to a private health facility, and maybe spend even more on such a test, the ministry is actually
Yes.
allowing them to, be able
Yes.
to do this very test at a reduced cost. Could you tell us about the Ministry of Health's partnership with the private facilities?
So, in our negotiations last year, we were actually able to bring the providers down to that price of $8,000 so that one standard voucher can be given to
Yes.
women. This service is available in the public system, but given the number of women that are eligible that we want to target for HPV testing, we found that we thought that it was necessary to partner with the private sector so that we will meet a wider scope, and so that we'll be able to screen more women
Yes.
in a faster time.
As we wrap up today's program, what would be your encouragement to women who haven't yet accessed these vouchers and may still have theirs at home and a bit hesitant about going and get this test done? What would be your encouragement to them?
So if you are that person, if you have collected a voucher and you have not cashed that, you have not utilized that voucher as yet, I encourage you to do so. Get to any of the facilities that's listed at the back of that voucher and do an HPV test. If you also know someone in your circle who has not had access to a voucher, encourage them to go to any of our health facilities and to get that voucher, and encourage them also, or take them to the facility to get an HPV test. Some persons might be hesitant to take this test by themselves. It might be advisable that you go in groups if you feel more comfortable doing that. But whatever you do, ensure that you get screened. It's better to get screened early and to know your status as it relates to cervical cancer.
Thank you for staying tuned to the program. Women are reminded to visit your nearest health center or health facility to pick up your cervical cancer voucher.